COVID-like symptoms don't always mean a COVID diagnosis, but a Where's the Money investigation found you're still paying for it. We discovered only about 1 out of 5 Medicaid patients who visited South Carolina emergency rooms with the typical symptoms actually had COVID. And those visits alone cost taxpayers at least $11.5 million. That's on top of the $50 million paid to treat actual COVID patients. But Nate Morabito's analysis of state data did find a silver lining.
Medicaid claims show even with the rise of COVID-19, fewer people visited the ER for things like sore throat, cough, fever, and headaches during the pandemic than they did in the year leading up to March 2020. Emergency rooms are strictly for emergencies.
Emergency department is crowded.
The emergency department is not a place for testing.
Yet COVID-19 has routinely strained ERs.
My biggest fear is that we're going to collapse our medical system. We are very close to it being overwhelmed.
South Carolina Medicaid data, a snapshot of low-income patient behavior, suggests the strain would have been even more significant had people not locked down. Compared to 2019 numbers, there were fewer ER visits for symptoms of cold or COVID during nearly every month of the pandemic until we hit August.
I think that's a factor really of people just not engaging as much in society.
Jeff Leieritz is communications director for the South Carolina Department of Health and Human Services, an agency that made telehealth more accessible at the beginning of the pandemic and watched e-visits skyrocket as a result.
That was really designed to keep people out of the emergency room for things that were not emergent situations.
As more and more claims come in for the end of last year, he expects the number of 2021 ER visits for colds or COVID to eclipse 2019 numbers. A situation that was probably made worse by people who misused ERs.
We have heard from hospitals that anecdotally that there are people that are going to an emergency room for a COVID test, just for a COVID test.
Another reminder that emergency rooms are among the most expensive places to receive medical care. From March 2020 through December 2021, Medicaid's funded $1 billion worth of ER visits in South Carolina alone.
We're always very conscious of the fact that we're a taxpayer-funded department and have a lot of measures in place to try to encourage people to seek care in the most appropriate and also the least costly setting that will suit their needs.
So far, COVID-19 isn't the leading emergency room diagnosis for South Carolina Medicaid patients. Instead, the data show acute upper respiratory infections are leading the way, better known as the common cold. Nate Morabito, WCNC Charlotte.
And we have the top 10 most costly diagnoses listed on this story on our website, along with other data breaking down how many people visited the hospital for non-emergencies where Medicaid footed the bill. Find it all on WCNC.com.